So, doctor, are you telling me that this is the reason a lot of babies die in Nigeria?
Absolutely.
What is this?
This is perhaps the best medical invention ever made. The Ambu bag. Simple, powerful, effective. The Ambu bag.
How can we use it?
Sometimes a baby is born and the baby is not breathing. It is very essential that within 60 seconds, when the baby is born, the baby should either be breathing on their own or someone is helping that baby breathe. Very important.
Okay.
It's called the golden minute, 60 seconds.
Okay.
But before that, as soon as the baby is born, usually when the baby is born, the baby is wet. So we dry the baby. Okay? Dry the baby. Especially a few rubs on the back to dry the baby. You don't need to hang the baby
So
upside down.
all those hanging upside down, slapping.
No. Please don't do that. You dry the baby. Sometimes just drying the baby is enough for the baby to start
stimulated.
breathing. And also, it's important that before the baby is born, hand washing. Our providers have to wash their hands. Get gloves, get your gloves on. We have the right area for the baby for resuscitation. And then, apart from the Ambu bag comes with a mask, 2 sizes. We say the small one for babies that are born early, what we call premature babies, and then the bigger one for bigger babies. So for this baby, you make sure the mask covers the mouth and the nose.
Okay.
We don't want to cover the eyes. Look at this mask. If I put it right here, it covers the mouth, the nose doesn't cover the eyes. You see that?
Yeah.
But the bigger one, if I put it too big.
Too big.
Too big. So this is
And
the right
doesn't have a
size.
seal.
And to the
So it's
seal.
supposed to have a seal.
It
So that
has
air
a-
doesn't escape.
Absolutely. So we put our bag on to help our baby breathe. Put the mask, apply the seal, and then we start to squeeze the bag. But there is a way we squeeze the bag.
So it's not just
No. There is a system to squeezing the bag. So, for example, you can count in your head to give you a rhythm.
Okay.
So, for example, we say 1 and 2 and 3 and breathe. 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 Ladies and gentlemen, that is all you need to do for most babies. By this time around, most babies are crying. Babies are crying, you take the baby to the mother, put the baby to the breast, done deal. It's important to make sure that the neck of the baby is well positioned to open the airway.
So that air can properly fill the lungs.
So that the air can fill the lung. So we just call this, we thought about the jaw lift, the jaw thrust and the chin lift. You just lift the chin. We say when you're putting the baby in the sniffing position. Okay. This is what our organization is doing across the country for Bread for Life. We're training healthcare providers on what to do when a baby is born and equipping them with Ambu bags along with our partners all over the country. This is important work and this is why we're here.
If a baby doesn't cry on time, what could that baby face?
If a baby is not crying on time, the baby is in danger. This is what we call birth asphyxia. They say brain and oxygen, they go together.
Yeah.
The brain needs oxygen. Once the baby is not breathing and it starts to get prolonged, but in that 60 seconds, if that baby is not breathing, then brain damage starts to occur. Because the nerves in the brain need oxygen.
What about cerebral palsy? Would you say cerebral palsy is linked to babies not breathing on time?
Absolutely, amongst other reasons. But this is one of the reasons.
One of the reasons.
Because the absence of that oxygen. So it's something we call hypoxia, low oxygen, ischemic, poor blood supply. So hypoxic, ischemic, encephalopathy, brain damage. Brain damage because of inadequate blood flow of oxygen containing blood to the brain.
So basically, the long and short is wherever babies are born, this Ambu bag has to be there.
Absolutely.
And you guys will know me. I've always been shouting these things. If you go to your primary healthcare centers and babies are born, this is one of the things that you need to see. Because I know that we're talking about most of these things, and it really doesn't concern the big hospitals. It's the small hospitals, the primary healthcare centers, the one in the rural villages. Make sure that there is an Ambu bag close by. It will save a lot of babies.
But let me shock you too. Many of our women don't even deliver in those places. The majority of our women deliver at home, deliver with community providers, not in the health centers, not in the hospitals. Majority of our women. So for every woman, wherever you have your baby, for every baby everywhere, a skilled attendant has to be present at the delivery of your baby.
Skilled, trained attendant.
Mothers must know this. Don't just deliver
Anywhere.
your children anywhere. You have to know, and you have to plan ahead. And then, lest I forget, there must be a plan. What if the baby gets stuck? What if labor is obstructed? There must be a plan to get you to the nearest hospital. A form of transportation. It has to be planned ahead of time. Ahead of time. And this, guess what? Many people may struggle with this, but I truly believe, because sometimes a baby has to be born by C-section. So it's not at the time they say, Oga,
That's why you not start planning.
you now start looking for money for C-section. Meanwhile, baby needs to come out. So if if your wife is pregnant, put some money aside just in case of that. Hopefully it will not happen, but put some money aside. People need to know this.
Thank you so much, Jeff. Remember, this will save a lot of lives. Have it wherever there's a baby being born.